do you use manual therapy, for example, to release posterior lower compression? Well, yes, Javi, I do. So we talked about maybe some of your classic manual stuff that you might be applying or you've seen apply, with whether you worked with some type of manual practitioner. But for me, the overwhelming majority of my manual techniques is done at the rib cage and pelvis to try to restore movement options within the ventral cavity. So if you've been following me for a minute, my bag is to try to manage the ventral cavity so we can get our supreme clientele to restore normal respiratory mechanics. What I mean by that is when you breathe in, the ventral cavity, thorax, abdomen, pelvis, should expand in all directions during the inhalation, and it should compress in all directions during the exhalation. So if you can't do that, and you have tried to move and you can't get that person to create expansion into a certain place, well, it might behoove you to try some type of manual technique to make that happen. I will bring my assistant in, and I'll demonstrate some of my favorites for you. Now you might be wondering, well, Zach, what is the name of your assistant since this is new? And, I haven't really thought of a name for him, but until now. So I shall call him Mini Z, is what he will go by. So we got Mini Z, we got my son, we have my grandson, because he's a little shorter. And then lastly, we have, this is new too, I'm really excited about this one. We got Ted. Ted's going to help us out as well. And you're probably wondering, well, why is this this one called Ted? The reason why this one is called Ted is because it makes me think of, when I saw this, it made me think of like Bill and Ted's Excellent Adventures. And I feel like this person would have done a lot of psychedelics in his day, and that's why he's got all these crazy colors. So there you go. There's the whole ZC family. So let's work on Mini Z for this first one. A lot of my manual stuff involves doing tons of stuff to the rib cage. We know, ladies and gentlemen, that the stack is muy importante. So if you can't get someone to stack actively, you might use a manual rib cage technique to get them to do it active assistedly. One of my go-tos, put the hand on the back, so I might grip some of the vertebrae, and then I'll put my top hand on the sternum. And I will basically have the person breathe in, exhale, and I'll guide the sternum down as my bottom hand is pulling the back upward. So what this is doing is it's essentially allowing them to drop the lower rib cage down effectively so they can create a better stacked position at the lower rib cage. While they're doing this, I'm making sure that they're also tucking the hips actively. Now, what if you're a dude like me and you're working with a female? Well, you could do this. You just got to make sure you get informed consent and you don't be a creep show. I tend to not do this because I don't want to take any chances in terms of having that patient feel uncomfortable. So if I'm working with a female and you're a bro, and rule number one, don't get sued. If you don't want to push on the sternum, totally fine. Sometimes what I'll do instead is I might just go on the lower rib cage, so below the breast tissue. So I'm kind of going right here. Person's on their back. And I might go on either side and just guide the ribs down that way. You got to make sure that when you go, it's more of an inferior pull, not like clamping them down. Because if you clamp down the rib cage, one, that can be uncomfortable because they're not going to be able to get air in. You want to make sure that the rib cage can move as you're doing this. But I'm just kind of gently gliding down, cueing them to keep ab tension as they're breathing in and out. So that's usually the first go-to. Can't stack, that might be the move you want to go with. Let's say you want to improve the ability to expand anteriorly. That's kind of important. For that one, there's a technique that PRI does that they call the superior T4, which I really like. There, again, put your hand on the sternum, Other hand is going to be just below the clavicle, so like right here-ish. And basically what you're going to do is when that person breathes in, you're going to inhale and you're going to help guide the rib cage upward. So I'm kind of sloping the skin superior towards the clavicle. Then when they exhale, I'm going to push the sternum downward. Now, if you are in don't get sued mode, because that's of course a risky position, you can get very similar effects by simply, if let's say I wanted to improve left pump handle, if I push the right first rib down, so I glide inferiorly, so what I'm doing in that case, I'll show you on the left side, is I take my web space on my hand and I push the first rib down. I am essentially levering the rib cage, so the rib cage on the left would be pushed down, the right rib cage is going to be pushed up. That can actually allow for anterior expansion as well. And the reason why that is because the first rib is a synarthroidal joint. That means that the first rib doesn't, there's no synovial fluid, so it doesn't move independently. So when you push on the first rib, it will lever the rib cage as a unit. So if I'm gliding downward on one side, the opposite side is going to glide upward. That can encourage anterior expansion. It's a great way to get someone to get that pump handle that you so desire. Posterior expansion. Ooh, this one's a doozy, a humdinger. There's a few different ways that I'll get this. One is and actually I'm going to use the spine for this one. So let's bring Ted into the mix. If I got my man Ted, with the bottom hand, what I will do is I will put basically the middle part of my hand, so between the thenar and the hypothenar eminence, on about C7-ish, right here, and I will push upward just on that C7-T1 vertebrae location. And then the rest of my hand's kind of cupped down like this. All right, so I kind of got like a cup. And I want to think about it like this cup, it is with this cup that I will catch the posterior expansion. So it essentially gives a bowl for the upper ribs to fall into as you breathe in. Now, what you have to do to force air posteriorly is to block it on the front. That's where Mini Z comes into play. You can push on the sternum, so push it down and inferiorly as you hold that cupped position. And a lot of times that will encourage some expansion posteriorly. Another way that I'll do that is sometimes I'll just put my pisiform, so the bony part on the outside of my hand, down on the manubrium. That's another great way to get that. I've also found that if you put your pisiform on the manubrium and you lift your hand up, if you're working with a female, there's like no chance I'm going to be touching breast tissue here. And I just make sure you get permission. So I'm just going to press in that area, use my hand to encourage expansion in the posterior thorax. One that I've been using that I really like to get it unilaterally is if, let's say I wanted to get left posterior expansion, I will take my hands, my fingers will be on the spinous processes in the thoracic spine, and I will take my fingers and pull the spinous processes to the right. When I pull the spinous processes to the right, that's going to stretch stuff on the left side of the upper back, aka you're going to get posterior expansion. But now here's the deal. You got to make sure that you're not getting air in the front. So what I will do in that case is I will either take, if I'm using my right hand to pull the spinous processes to the right so I can get left posterior, I'll take the hypothenar side of my hand, I'll go right below the clavicle like this, and I'll push down so that way they're not getting air into the front side. Again, if you're a male, you're working with a female, you don't want to take any chances, lever down on the first rib, just like before. Because, also think about this, folks, if I'm pulling the spinous processes to the right. It's going to get me left posterior, but it's also going to get me right anterior. Because when the spinous processes go to the right, the backside on the right is blocked. It's not really blocked, but you know what I'm saying. So you're going to be able to drive more air into the front if you glide the first rib down inferiorly. That's going to lever the left side down, right side's coming up. You're going to get anterior expansion on the right, and subsequently you'll get some posterior expansion on the left. Those have been some of the most effective rib cage techniques that I've messed with currently to get front side expansion, back side expansion, and to help your peeps get the stack. Now at the pelvis, because I think it's equally important to restore movement dynamics at the pelvis. For that, I got a few different techniques that I utilize. We'll pull my grandson in the mix to help here. One, and this is one that I got from Daddy O'Pops that I think is just like a really good general AP expansion. You got someone who's limited in multiple directions, this is your move. So what you want to do is you're going to basically press on the side of the pelvis, so someone's lying side lying. You lower your table all the way down, and you just smash your body weight down into, so I'm above the trochanter, and I'm on the base of the pelvis or the ilium, and I just push straight down. So you think of it this way, I'm squishing laterally so I can get expansion A to P. That's a really good move to just get general pelvic movement. Another move that I like to do, and this is more part of the stack, is, so we did stuff to encourage lower rib cage to drop. What if you got someone whose counternutation is whack? Well, there what you can do is you can, I can't demo this because I'm on IG, but if you passively pull someone's knees to their chests, and then you take your knee and you put it underneath the tailbone, that will encourage a little bit of passive counternutation. And then with this hand, my opposite hand, I will press down through the lower rib cage. So I basically encourage the stack. Like, this is a really good move. And a lot of times if someone's got like low back tension, you have them breathe in that position, all the viscera is just going to go into the lower back, and it's a really good low back stretch. So think knees coming up to chest. You're going to curl the pelvis into counternutation, have them breathe in, breathe out. Life is good. Other things that I'll do at the pelvis. One that I like, if you need someone who needs to work on their ability to rotate the sacrum, so you've gotten the stack and they need to start improving rotational aspects. If you have someone lie on their side, I will just manually shove the hip backwards with my body like this, boom, and then I'll have them drive the leg down into adduction. It's a really good posterior hip stretch. And another one that I like to do, very similar, one leg's extended, one leg is flexed. This could be someone who you're just trying to clean up that last little bit of knee to chest or hip internal rotation. You're here, roll over the pelvis. It's another good way to get the posterior hip to stretch out. Those would be some of my major go-to techniques to improve movement capabilities that are a bit more specific to some of the ventral cavity management stuff that I've been talking about. So, and a lot of these, you find from sources, but also if you just think, and that's really what I think about with manual therapy right now, because like all you're trying to do is get the person into a position that they currently cannot achieve. If you understand biomechanically what you need to accomplish, you can drum up anything. And that's really what a lot of these manual techniques came into. I get someone who has a limitation in horizontal abduction. And for the life of me, I can't get them to expand T2 to T4 because we know, based on some of the stuff that I've talked about in the past, at least within my model, that T2 to T4 expansion, if you can get that, it should allow you some clearance into horizontal abduction. That's literally where I messed around and did the pull of the spinous processes and press down on the lower rib cage. You get a nice little stretch localized to that area. You get test changes. I want you to think about, and even if you disagree with the way I look at movement and you got your own way, just think about, what am I trying to accomplish? What position does that person need to place their body into to accomplish that particular movement? And then how can I use my hands and my body to help them get there? And if you do that, you're going to get way more out of your manual therapy. You'll be a lot more laser-like with your manual therapy choice, and you ought to be in business. Javi, rockstar question.